All right. Hello, everyone. Welcome to parasitology. This is part one. And as usual, this is going to be a little strange. Actually, let me get started and then I can talk more. So bear with me. Go get a cup of coffee or something. Okay. Okay. Now, what was I going to say? Well, again, these PowerPoints and this lesson, I need to speak kind of slowly and deliberately for the subtitles to work. I will try not to say as much as I do. I really say that a lot. And the slides are kind of wordy. I don't mean to just sit here and read from the slides, but I am going to do that a little bit. This chapter is Byzantine. That's a very good word. It's named after the Byzantine Empire. I don't know what was so involved or convoluted or complex about the Byzantine Empire, but apparently it was a very complex and convoluted place. Chapter 12 is just like that. I don't know why they wrote it or organized it the way they did. It is so jam full of information that seems unimportant. So I will try to be your navigator through chapter 12. So with that, let's start talking a little bit about parasites. We don't think a lot about parasites in humans, maybe a little. If you have kids, you've maybe worried about them getting head lice. If you do a lot of hiking or camping, maybe you worry about ticks. You probably don't worry that much about intestinal worms, although if you eat raw meat or sushi, you might. If you do a lot of camping or hiking, you might worry about giardia in the water. So I guess we do worry a little bit about parasites. But if you were a dog or a horse or a hedgehog or a turtle, you would worry about it a lot more. And that's what today is all about. I have some samples here that I'll be, showing you as the day goes on. We worry about parasites in our pets, even though some of the parasites are more of a nuisance than anything. For those of you who took clinical lab techniques last semester, we'll be doing some review of parasites. But for Jackie and Caitlin, I know this might be new to you, so I'm just going to review this for everybody. Look real closely. You see this little white thing sticking out of this dog's butt. That is a called a proglottid, which is a segment of a tapeworm. So that is a little tapeworm waving at you from this dog's butt, this little piece of a tapeworm. It's not deadly. The dog doesn't care. It's just gross. Same with fleas. Lots of dogs will have fleas without causing problems, but they're gross. Some dogs and cats get very serious problems from fleas too. Other parasites can be deadly. You'll be learning about heartworm. We've learned last semester about a little blood-sucking worm called the barber pole worm in ruminants. Liver flukes can damage a ruminant's liver. A lot of animals have roundworms. That's a lot of roundworms, but it's not usually deadly, but it can make animals sick. So here's a horse with a particular parasite that's migrating through his brain. So some parasites can be deadly. Some can just make your patients really, really sick. Some can weaken their immune system and allow them to catch other diseases. I kind of need my glasses here. We'll learn also about that there are also parasites that are outside the body. We call those ectoparasites. The first part, we'll be looking at parasites inside the body, the parasites we call endoparasites. Another concern, another reason we care so much about parasites is you and I can catch these parasites from our pets. Sometimes they can just give us diarrhea, maybe not the worst thing, but some zoonotic diseases can be quite serious. A major cause of blindness in children is from a parasite. These horrible itchy skin lesions are from a parasite, and some can be deadly. We learned last semester about the raccoon roundworm, and it sent this one little boy to the intensive care unit. The mother almost lost him. So bear all this in mind. What is a parasite? We have a general sense from life and of course from movies. Parasites are very creepy. We talked a little bit about this last semester. You know, we can use the way parasites are shown in movies to help understand what parasites are. So of course there's Venom, who is a parasite to Spider-Man. My Little Pony, these are technically parasprites and not parasites, but I think parasprites are like parasites and they're causing whoever this little creature is to break out in those red spots. And of course, there's the Oscar-winning Best Picture is called Parasite. I haven't seen it. I don't know anything about it, but just so you know, right, parasites are on our mind. In nature, a lot of different creatures can live together. Sometimes they even benefit one another. A sea anemone has a clownfish living in it. The clownfish is not a parasite. I think they actually both benefit from the arrangement. You have protozoa and things living in you that are actually helping you. They're protecting you. But when they harm you, then they are considered a parasite. With parasitism, they benefit, but you or the patient is harmed. So that's another important concept. A third important concept is that parasites, they mature through different developmental stages. It could be a larval stage in a flea. We use that same term, larval stage, in the nematodes. Every parasite has different stages. And for heartworm in particular, the antiparasitic that will kill a larval heartworm will not kill an adult heartworm. So it's important to realize that they're not always the baby and the adult version of the parasite are quite different. What are the types of parasites? We're going to talk about them a little, and of course, we'll talk about how you kill them, how you prevent them. Nematodes, that's what you're seeing right up here. You might know them also as roundworms or heartworms or hookworms or whipworms. Cestodes would be the tapeworms. We'll talk about them. Let me go back here. Trematodes we can talk about. Those are also called flukes. We're not going to say very much about flukes. There's really only one medicine that is used, but these are these kind of weird flatworms. Protozoa we'll talk about. In particular, we'll talk about Giardia, coccidiosis, toxoplasmosis, and sarcocystosis, which this causes a condition called equine myeloencephalitis, equine protozoal myeloencephalitis. The subtitles are getting that wrong. And finally, we'll talk about the ectoparasites, which are all made up of arthropods, things like mites and lice and ticks and fleas and flies. And I hope your skin crawls a little bit. I want to make special mention of one particular ectoparasite called Demodex. Again, we learned about him last semester. Those of you who took clinical lab techniques, you're going to hear Demodex mentioned a few times because some of the drugs were or are used to treat Demodex. The phrase you'll see in chapter 12 and here is demodectic mange. Demodectic mange. And that refers to mange caused by this little stinker here. Well, I shouldn't say he's a stinker. He's a normal part of the skin fauna. That means he's a normal resident of dog skin or cat skin or rat skin. The problem is in some young animals, they overpopulate. The animal's own immune system does not keep them in check, and the Demodex can cause hair loss. That can lead to a secondary infection, and you get these miserable hairless dogs. But with treatment, they can get better. And again, that's what Demodex would look like under the microscope. But I just mentioned this because you're going to hear Demodex mentioned several times in the chapter. So I wanted to take a moment to review what Demodex does. And really, this is the whole point. Why are we learning this? Well, why do you think this might be important? In the many, many jobs that the vet tech does, why would trying to make sense of all of these crazy drugs, why would that matter? Well, think about it, and we'll come back to that in a moment. I'll go through this pretty quickly. We're going to break this up into 3 parts. So in part 1, we'll discuss some of the challenges in understanding and using the antiparasitics. We'll describe some of the principles, review some terms, apply some anatomy and physiology to understanding how these antiparasitics work. So we'll describe the life cycle of nematodes, describe how some of the anti-nematodals work. In part 2, same thing, but we'll talk about cestodes, trematodes, and protozoa, and about, of course, the drugs that kill them. In part 3, same thing, but then we'll talk about the common ectoparasites and the drugs that kill them. So let's start out with some challenges. Now, I just want you to know, I know how you feel. I remember working at the Greenhaven Veterinary Clinic and seeing these drugs like fipronil, lufeneron, imidacloprid, cydectin, all these different drugs, and I thought, I will never be able to keep these straight. And now, after many years of using these drugs, they are like old friends. And I encourage you to think of these drugs as being friends. I realize there's a lot of them, and I do not expect you to memorize very much of this chapter, but there are certain big concepts you must understand that will help you going forward. So first of all, I am well aware that there are a lot of drugs crammed into this chapter. Hold on. Another challenge, of course, is that new drugs keep coming out. Just when you understand one group, a brand new class of drug gets invented. That's exciting, but it also means you always have to stay current. Luckily, everything you're learning in this class will help you make sense of any new drug that comes along. You need to know both the generic and the trade names. In this PowerPoint, I have all the trade names underlined. But you need to know the generic names because the generic names will show up on a bunch of different products. It'll help if you recognize drugs within a family. So you'll see certain drugs that all end with ectin, ivermectin, selamectin, moxidectin. That ectin ending will help you recognize its personality, which drug it is, how it works, possible side effects, etc. All of the drugs today, almost all, work by stimulating either inhibitory or excitatory neurotransmitters. In fact, we should expand that. They work by messing with the nervous system in different ways, either exciting the nervous system or depressing the nervous system. And you'll see all these different ways they do that. Another challenge is that some of these drugs are regulated by the FDA and some by the EPA. What that means is you can go to the pet store and buy Advantage, which is a topical and it's a topical flea preventive, but you cannot go to the pet store and buy Revolution, which is a topical flea preventive. They are kind of similar in that they kill fleas, but Revolution is a little different. Revolution, you'll see, kills other things. The FDA regulates either oral antiparasitics or parasitics like Revolution that actually get absorbed into the bloodstream. Not all, but most of those will require a prescription. But there are other drugs that go on the skin that do not get absorbed into the bloodstream. Drugs like Advantage, Frontline, a lot of the topical fly repellents you can buy at Sutter Orchard Supply or Tractor Supply. Those are regulated by the those are regulated by the EPA, the Environmental Protection Agency. And so those you often do not need a prescription for. Sometimes you do, but usually you don't. They are available OTC, which means over the counter. And then let's go back to, what does this have to do with you? Well, a lot of what you're going to be doing is helping both patients and clients. So, for example, your clients, let's actually start with clients and not patients. They're gonna ask you, why should I spend $80 on your flea prevention when I can get a flea collar off Chewies.com or Chewy.com for $5, right? Why should I spend $80 at your clinic? Or clients may tell you, oh, I give my dog flea baths. That's how I control fleas. You can help save your clients a lot of grief if you are familiar with parasites and with antiparasitics. And really, in the long run, you can save them a lot of money too. The patient is also in trouble. The patient could have a disease. The patient could be at risk for catching a disease. You are in the perfect position to educate the client about preventing and treating the disease, maybe clinical signs to watch for. If the patient is under your care, you know that there are certain drugs we cannot combine. So wouldn't you want your veterinary technician to be very well acquainted with antiparasitics? I know I would. The other thing is public health. We saw those various zoonotic diseases. You help protect public health, which is part of the oath. There's a reason why the veterinary technician oath, let me just go back to that, right? Right? I solemnly dedicate myself to aiding animals and society by promoting public health. There's a reason why that's included there. And of course, somebody needs to stand up to Dr. Google, who will promise people impossible things. So those are some challenges. When it comes to antiparasitics, this would be the ideal situation. The ideal parasitic would be one that is only toxic to the parasite and not the host. It would be cheap. That'd be nice, especially if you have 500 goats or 2,000 cows. It would be nice to have something that was economical. It'd be nice if it would kill all stages, all life stages of a parasite. Again, we'd like it to be safe, even if a patient were sick or elderly. We'd like it to be safe for pregnant animals. You'll see how some species of animals and even some breeds of dogs are highly sensitive. And finally, we'd like it if the worms would never, ever develop resistance. There is no such ideal drug, but these are the principles we use when we design or choose an antiparasitic. There are some terms that are used. Some of them I think are a little silly, but you'll see them used. One, I'm not even sure how to say this, but the term is anthelmintic. And a helminth is just a general word for a worm. So an anthelmintic would just be a general internal parasiticide, something that will kill internal worms. You'll see this term a lot on bottles. I kind of want to look at this bottle here. Well, that doesn't say anything, but you will see that. It just means general dewormer. Terms you'll hear are anti-nematodal. That just means, VS just means versus. So that just means that it kills nematodes. Anti-cestodal means it kills tapeworms. Again, these are some nematodes, roundworms, whipworms, hookworms, and then here's a tapeworm. Important to remember, tapeworms are totally different. Tapeworms are nothing like roundworms and whipworms and hookworms. So please remember that. Anti-trematodal would mean it kills flukes. I put parentheses because it's just not a very common term. So, but it's in the book, so we'll mention it. Anti-protozoal. Vermicide means worm killer, and vermifuge means worm paralyzer. I have never seen these terms before, but there they are. Who knows? Maybe you'll use them in conversation tonight. So let's talk about parasite number one, the nematodes. What are they? Nematodes are everywhere. If you took a handful of dirt, there are probably thousands of nematodes in the dirt. They are helpful. Even if they're not helpful, they're usually harmless. But there are some nematodes that are dangerous, that are parasites. We'll start here talking about the gastrointestinal nematodes. Later, I think in part 2, we'll talk about the heartworm specifically, which is not a gastrointestinal nematode. But let's talk first about, we'll talk about them all in just a moment. So these are actual worms. I mean, they can be quite long. They're multicellular. They're not little teeny tiny things like the protozoa. They're cylindrical. They've got a mouth at one end. They've got an anus at the other. They're not flat. like the flukes and the tapeworms. They've got a real tough outside skin called a cuticle. They are male and female. That's unique. Um, Among these gastrointestinal parasites, they are the only ones that are male and female. They're not asexual like those protozoa, trematodes, and cestodes. These are some of the parasites, some of the nematodes you may encounter. There's whipworms. That's an intestinal worm. Dogs get it from what's called the fecal oral route. So they somehow ingest another dog's feces. It causes colitis, often bloody diarrhea. Roundworms are also called ascarids, another intestinal worm. Animals can get it again through the fecal oral route. Somehow they eat the egg of the parasite, but puppies and kittens and other young animals, they can get it transmammary. That means it travels from the lactating mom across her mammary gland into the milk, and sometimes these can travel across the placenta. So while the young animal is still in the mom's womb, the roundworms can travel across the placenta to infect the unborn puppy or foal or calf or whatever. There's hookworms, another intestinal worm. These nasty little teeth here inside someone's intestine. Similar how patients can get similar to roundworms, although animals and people can also get them across the skin. Again, many animals have their own kinds of hookworms. That's showing you a hookworm. That's showing you the inside of intestines with a bunch of hookworms attached to the wall and sucking blood. And finally, heartworms, not an intestinal worm. They are instead a circulatory system worm. They're spread by mosquitoes, right? They're not a fecal oral route. And the juvenile worms, they'll migrate to the right ventricle of the heart and reach adulthood there. And you can see these heartworms are just choking off that heart. It's important to understand the life cycle, especially it will help you understand how we treat heartworm disease. But in general, the typical nematode life cycle is quite simple compared to flukes and tapeworms. For all of these, there's an adult female and she produces an egg, which is just a little single cell within this little eggshell here. These eggs are very tiny, you can't see them. Inside that egg, a little larva is going to form, and you can call it a baby or a tadpole, but we're going to call it a first stage larva. He or she will break out of that egg and will molt. Think of, as a snake gets bigger, it will shed its skin. That's sort of like what these guys are doing, although they are changing quite a bit as they grow. So the first stage larva called L1 will molt into a second stage larva, and then into a third stage and a fourth stage, and then into adulthood. And this can take 6 months or less, depending on the nematode. For the heartworm, the life cycle is the same, except there's no egg. With heartworm, the adult female gives birth directly to these first stage larvae. And that's part of why we're going to discuss heartworm separately from roundworms and hookworms. So roundworms, they have some zoonotic potential. They can cause blindness in children. The problem with roundworms is if you or I somehow eat roundworm, a dog roundworm, the roundworm does not know what to do. If it's inside of us, it can't find the usual signposts that tell it where to migrate. And so they start to migrate into our eyes or into our liver, places they really don't belong. They say that humans are aberrant hosts. Aberrant just means not the normal host. You could also call an aberrant host a dead end host because the parasite can't develop into adulthood. It just wanders around causing damage until it dies of old age. And there are other nematodes like the raccoon roundworm that will actually migrate into a person's brain. It gets lost. It doesn't realize you're not a raccoon, and it goes to the wrong organs. Hookworms, we mentioned, they can get lost in the skin and cause these red pruritic lesions. So again, these are some of the reasons why we want to be knowledgeable. Well, let's talk about some of the antiparasitics that kill nematodes. So specifically, we're talking about killing roundworms, hookworms, and whipworms. So, and then we'll talk in part 2 about killing tapeworms and protozoa. But the reason I have, these are all neurons here. I just have these neurons here. These, you can see all these neurons. This could be in your brain or your spinal cord. And they're all firing just to show you how, just to kind of remind you that that's how a lot of these drugs work. They work by either causing overexcitement of neurons or they suppress the activity of neurons. And I thought I would bring this back from, this is from week 3, just to review this with you, because I think it'll help you understand how these drugs work. Now, very important, I don't expect you to memorize how every single drug works, but you do need to know whether they are excitatory or not, or whether they are inhibitory. What I mean is, I think I mentioned this later, some of them excite the parasite to death, and some of them depress or paralyze the parasite to death. That's important to know because, well, you'll see why it's important to know. But so first, let's review receptors, agonists, and antagonists. So you may remember every cell in your body has these little, you can call them like puzzle pieces or a lock, or they're called receptors. They're just these little unique locks, and drugs can fit into those locks like a key and cause something to happen. If the drug causes something to happen, we call that drug an agonist. If the drug does nothing but just blocks that receptor and prevents something else from activating that receptor, we call it an antagonist. So again, here's an agonist causing something exciting to happen in a cell. Here's an antagonist blocking that same receptor, preventing an agonist from doing anything. And you'll see that the antiparasitics that are agonists or antagonists, they will usually be to a receptor on a neuron, or in some cases a muscle cell. It could be a cardiac muscle cell, it could be a skeletal muscle cell, so you'll see. How do neurons work and how do they communicate with other cells? Let's review that. Again, here's a neuron receiving information from another neuron, and it creates this electrical signal that travels down to this neuron, or it could be another cell, and at that point it has to use what are called neurotransmitters in order to to either stimulate or inhibit these other cells. How do they work? Remember, neurons are electrical, and they use electrolytes to create electricity. In particular, they use the movement of two electrolytes, sodium and potassium, to send electrical signals from one end of the neuron to the other. And in this animation, you'll see, we use this word to depolarize and to repolarize. Depolarize is when all these sodiums are going to rush out, and then repolarize is when these potassiums are going to rush in. And just appreciate that all of these have little positive charges on them. If you look very closely, you'll see the sodiums all have a little plus, and the calciums all have a little plus on them. Now, when a neuron is stimulated to fire, these sodium channels open up and sodium rushes in, and that's called depolarization. It's making the negative charge that's inside, it's making the negative charge inside the neuron more positive, and then that sets off this chain reaction. The inside of the neuron is a little more negative than the outside, and when all these sodium ions rush in, they make the inside a little more positive, and that causes this to happen. It causes this electrical signal to rush down the neuron. Again, just showing you these positively charged sodium ions rushing in. Remember that, because you're going to see how some of the antiparasitics change that. Other antiparasitics work here. So for a neuron to communicate with another cell, this electrical signal can't jump over this gap. Instead, little chemicals called neurotransmitters are released. These are receptors to those neurotransmitters, and then they will allow sodium to rush in, or not. They may allow chloride to rush in to prevent this from firing. These are all things that are happening in you in health, a normal, healthy situation. Again, some neurotransmitters will stimulate a neuron to fire. Others will prevent a neuron from firing. And not just neurons, right? Some neurotransmitters are excitatory, not just to neurons, but to something else. So they could be excitatory to muscle cells, and then that would trigger the muscle cell to contract. And here, for example, is skeletal muscle. Every time you move a muscle, neurons are dumping a little neurotransmitter called acetylcholine to make your skeletal muscles work. Acetylcholine is used for other things too. It's also used by your rest and digest system to do things like slow down your heart rate. And you'll see that later too. Now, why is it important? Like I mentioned earlier, some of these antiparasitics, they work by paralyzing parasites. They make it harder for the parasite's neurons to depolarize. But there are other antiparasitics that are the opposite. They overstimulate certain receptors. So I'm trying to show, here's a little worm being paralyzed, here's a little worm being overstimulated. You'll see there are other antiparasitics that work by blocking a particular receptor. In other words, they act as an antagonist. And some antiparasitics don't work on receptors at all. You may recall from biology classes, you have all these little organelles, things like mitochondria and Golgi apparatus. Well, you also have these things called microtubules. They actually do a lot of different things. They help cells to divide. They also, well, you'll see what they do, but you'll see that some drugs, some antiparasitics work by interfering with these microtubules. And I'm going to use the Wicked Witch of the West to help explain that later. All right, now let's look at some specific anti-nematodals. All right, do any of these look familiar to you? I got a few right here. Like I've got this one called it's backwards, looks like. And this contains ivermectin. That's weird. Why is that backwards? We'll talk about these. All have something in common. They all contain a very similar drug, a group of drugs called macrolides. So moxidectin, there's moxidectin again. There's moxidectin again over here. There's ivermectin, that's similar. This milbemycin is here, milbemycin here, milbemycin here. So all of those drugs and others have certain things in common. It's a group of drugs called the macrolides. Very big group of drugs, really wonderful group of drugs. It's got a wide spectrum of activity against nematodes, but also sometimes against ectoparasites like lice and mites and fleas, sometimes, mostly lice and mites. And I didn't mention it, but also flies too, sometimes, mostly lice and mites. They are not effective against tapeworms and flukes. And they're made up of two groups. There are the avermectins and the milbemycins. I don't care if you can tell the difference. They are so similar that we can consider them the same group of drugs. So we're just going to consider them as one group, the macrolides. Avermectins and milbemycins are just consider them the same group of drugs. So all these drugs, these that we call the macrolides, they're named after this thing right here. There's this little ring that we find in all of these drugs. Big deal. These are lipophilic drugs, so they get distributed all over the body, including the brain, the central nervous system, because there's a lot of fat there, and these guys are fat-loving. And these will also stay in the body for days, which is bad news for parasites. The body will often get rid of it through feces. I don't know if the body gets rid of it through urine, but it's important that the body gets rid of these drugs through feces, and you'll see why in a moment. How do they kill? The term the book uses is mechanism of action. And mechanism of action is a good pharmacology term to know, especially when new drugs are invented. You'll read, oh, the mechanism of action is blah, blah, blah. Mechanism of action just means how it works. Well, remember that most of the drugs today are neurotoxins, and the macrolides are no exception. They are going to stimulate a particular neurotransmitter. They're going to stimulate the receptor of a neurotransmitter known as glutamate. Now, glutamate is an inhibitory neurotransmitter. You may remember when we learned how phenobarbital and the other anti-seizure medicines work. They work by stimulating another inhibitory neurotransmitter called GABA. GABA is a very famous inhibitory neurotransmitter. I think we have glutamate too, but in parasites, these drugs will, by stimulating glutamate receptors, they will inhibit a neuron and make it so hard for neurons to fire that all of the motor neurons just stop working, and the poor little parasite is paralyzed to death. So their mouth won't work, so they can't eat. Their muscles won't work, so they can't crawl around, and they're dead. Remember, we said these drugs don't work on tapeworms and flukes. That's because they don't have the glutamate receptors. Only the nematodes have them. I think we'll see that some of the ectoparasites must have these receptors too. And we mentioned that it's lipophilic, that it can cause paralysis in parasites, it's excreted in feces. Who cares, right? Right? You give your horse some ivermectin, or you give your horse some zymectrin, which has, a macrolide in it. Who cares? Well, are dogs known to eat poop? Do they ever eat poop? It's possible, right? So if you gave this horse ivermectin and your dog eats that horse's poop, that dog could get an overdose of ivermectin. And guess what? It will have the same effects on the dog that it has on a roundworm. It will cause weakness and paralysis and things like that. Remember also, from a few weeks ago, there are some dogs that really cannot handle ivermectin. And we say ivermectin, it's really any of the macrolides. So we talked a few weeks ago about dogs that have this genetic mutation. I put that, it should be MDR1. It stands for multiple drug resistance 1. So not MRD1. Let's see if we can change that. Okay. And the reason that MDR1 is important is it causes production of faulty P glycoprotein. We talked about P glycoprotein plays a big role in absorption. It actually helps prevent absorption. It's not when you're trying to get a drug into a patient, P glycoprotein is kind of annoying. You're trying to get an antibiotic into your patient in a pill, but the dog or cats or horses P glycoprotein will pump it back into the lumen of the intestine. Let me say that again. P glycoprotein is kind of annoying when we want a drug to get absorbed because it will pump it back out. The problem though is when we design drugs, when these big drug companies make the drugs, they assume that a certain amount will get pumped back out by P glycoprotein. It's not just found in the intestines, it's also found in the blood-brain barrier. And we compared them to bouncers a few weeks ago. Well, the problem in certain breeds like the collie is that they have this MDR1 mutation and the pumps don't pump. And what happens is this. This I think does a pretty good job. So this is showing you the blood-brain barrier. Here's a normal amount of, let's say it's ivermectin. A normal amount, remember that these drugs are very lipophilic. So these drugs can pass across the blood-brain barrier, but that's okay because the P glycoprotein right here is going to pump it back out of the blood-brain barrier. Now this dog has that MDR1 mutation, and you can see it says MDR1 mutation results in a broken pump. Now when this ivermectin flows in, it accumulates and it does not get pumped out because the pump is broken. And now this drug is having the same effect on the dog that it would have on a parasite. Depression, ataxia, seizures, death, death by paralysis, basically. So what are some of the macrolides? This, I don't really expect you to have these memorized. There's just too many, and if you don't use them, it's really hard to keep them straight. There may be a few that I think you should memorize. And I'll let you know that in a study guide. So for example, you should probably know which drugs contain milbemycin. So like Trifexis has milbemycin in it. But hold off on that. Let me decide, which you should know. So there are some that are used real commonly in small animals. So ivermectin shows up in a lot of heartworm medications. Well, I should say it shows up in a lot of dewormers. Doramectin, aprinomectin mostly show up in livestock. Milbemycin shows up in a lot of different products. I'm not sure why I put moxidect in there. I'm not sure why. Oh, those are just examples of the milbemycins, that's all. So we'll just look at each of these a little more in depth. So ivermectin, again, these are all very similar. We find it in HeartGuard. It'll kill heartworms as well as roundworms and hookworms. Again, they put ascarid here. That means roundworm. It shows up in injectable solutions. It shows up in these oral pastes for horses. By the way, these taste horrible. These horse dewormers are awful tasting. Ivermectins are really safe when they're at these doses in like HeartGuard. They are not going to harm a dog with the MDR1 mutation. We also can use ivermectin in lots of other species. It's used in reptiles and birds and hedgehogs and wildlife. So it's really a very useful macrolide. Another macrolide that you will see is in Revolution. Revolution is just this one drug called selamectin. It's a topical, right? When you see that little symbol up there, that means it's some little drop that you would put on the dog or cat's skin. This one gets absorbed into the bloodstream from the skin. So that's why it can be used to treat even a parasite like heartworm. It's pretty good at treating mites and fleas, all around a pretty nice drug. There's the ones we use in livestock, like doramectin and aprinomectin. Again, good activity against the endo and exoparasites. Or exo, I should put ectoparasites. There's this other group called the milbemycins, but again, we're just going to consider them all part of the macrolides. We find milbemycin in drugs like Interceptor. It's combined. Well, here it's Interceptor is just the milbemycin, so it'll be a good monthly dewormer for heartworm and roundworms. Here, the milbemycin is combined with a flea preventive, and we get this product called Trifexis. Here, the milbemycin is combined with another product called lufeneron, which is a totally different kind of flea preventive. We'll talk about that. And here, the milbemycin is in little eardrops because these are good at killing mites as well. So all the same drug in just, combined with different things or in a different format. One really nice thing, and you should know this, a nice thing about milbemycin is it's very good at killing whipworms. Milbemycins are very good at killing whipworms. So you could use any of these products, Trifexis, Interceptor, for whipworm infections. I don't know why, but some of those other drugs, they don't work so well. So let's just highlight that. This is an important thing to know, that in treating whipworms, what the heck am I doing? treating whipworms, we like milbomycin. Yes, we like the milbomycins. And now I have to go back. Oh no. Okay. I'm not going to highlight too many things because that just took 10 minutes. Okay, other macrolides, there's moxidectin that shows up in Advantage Multi. It shows up in ProHeart. Again, it's really hard. I would not expect you to, I'm not going to ask you what's in ProHeart. But if I say, hey, what family of drug is moxidectin? You should be able to tell me something about macrolides, okay? And as time goes on, you should, when you go to internships, start looking at the shelves, see what is in the different antiparasitics at your internship or at your workplace. You'll start to see patterns. Oh, there's moxidectin. Oh, this is a heartworm. This is an injection that's given once a year. That's really cool. There's also one called ProHeart 6. That was the original product where it was an injection given once every 6 months. But anyway, it's a macrolide. Okay, those are the macrolides, big, broad, life-saving group of anti-nematodals. You'll see them again when we talk about the ectoparasites. Let's talk about some other anti-nematodals. So do any of these look familiar? Now I know I just put HeartGuard there, but I'm putting it here because there's this drug called Pyrantel. Here's a drug called fenbendazole. Here's a drug, I don't even know how to pronounce that, imodipside. Here's one called piperazine. What are these? Let's talk about these. But here's Panacur right here in this tube. So each of those are different anti-nematodals, and we'll talk about each one. So first we'll talk about the ones we call them benzimidazoles. Benzimidazoles. I'm not really sure how to say it, but that's what they're called. These end with the word azole, so just watch for that. These do not attack receptors. These attack these microtubules that are inside of cells. They're inside of this hookworm, for example. If we could look at his cells, he has these tubules in them. You and I probably do too, but I don't care. He has them. Most nematodes have them. They're called beta tubulins, but just think of them as these long microtubules. Think of them as like the spokes in a wheel or the spokes on an umbrella. I don't know what they are, but they help with structure. They help with mitosis. They actually help with certain biochemical reactions. They do a lot of important things. If you can get rid of them, if you can destroy them, well, you will destroy the parasite. And so I have it because I have the mind of a 5-year-old, and I think in terms of things that a 5-year-old would think of. I was thinking of the Wicked Witch of the West melting when Dorothy throws water on her. So this is what the benzimidazoles do to nematodes. Okay, right? The Wicked Witch is melting. There we go. That's what they do. That's how I am going to remember what the benzimidazoles do. Now, unfortunately, they're not that great at killing nematodes. Some of them are not that great, but they're still pretty good at killing other things. So remember that. but there they are, killing, right? This could be a roundworm, whatever you like. Okay, so what are some benzimidazoles? Well, one you may see at your internship site. Open the refrigerator and you may see little bottles of Tresiderm. Tresiderm contains what's called thiobendazole. Now, this is an ear ointment. It's used to treat ear infections. It's not treating nematodes in the ear. This used to be a really important dewormer in livestock, but over time, the worms have developed resistance. And in your discussion next week, I would love it if some of you would look into that. That's one of the choices, is to look into parasite resistance. It does still have some antifungal properties. So it can be used to treat otitis externa, which is a yeast that can cause ear infections. The full name is Malassezia pachydermatitis, but it's still a very effective treatment for that. And you'll see that there are other drugs that end in azole, but we'll talk about that later. And you'll see this has thiobendazole. It also has dexamethasone, right? That's the glucocorticoid that reduces inflammation. And then neomycin is an antibiotic. So all three of these can help with an inflamed, infected ear. This product is still used, but not for its original purpose. So fenbendazole, like thiobendazole, used to be a livestock dewormer, but now most livestock worms laugh at it. This is an example of client education. Look right down here, and you'll see this. I just want to highlight this for you. So you'll see clients will go to the pet store. You can buy this at most pet stores, and they'll say, oh, look, it kills tapeworms. And they'll buy this and give it to their pet. Well, the problem is the tapeworm it kills is not a very common tapeworm. It's called Tinea pisiformis. That is not the tapeworm that their dog or cat probably has. So one of the things that we can do is help clients choose the right product. This would not be the right product for most tapeworms. We do use Panicure a lot because it's really effective. It helps to treat a protozoa called Giardia that we'll talk about later. Okay, and then the final benzimidazole is called valbazen, and it's the one drug that's mentioned that can remove or control liver flukes. That's the only thing I've seen it used for. This shows a liver, and here are these really evil, flat flukes munching their way through the liver. Well, I don't know if they're munching, but they are burrowing through the liver. And you're probably never going to use albendazole, but if you do, you should remember that it can cause birth defects. So that's what or teratogenicity means. It means it can cause birth defects. So you would not want to use this in a pregnant animal. Now, side note, remember I said you can often use the ending of a drug to help identify it. So thiobendazole, albendazole, fenbendazole, right? Those are all the same group. There are other drugs that end in azole that are not benzimidazoles, even though they actually seem similar. So there's one called metronidazole. That's a wonderful antibiotic, but it is not a benzimidazole. And then there's other drugs that are used to treat fungal infections like fluconazole, ketoconazole, itraconazole, miconazole. They end in azole, but they are not benzimidazoles. Okay. This is probably the most common dewormer you'll see in small animal practice. It's pyrantel. You'll see it sold also as Strongid or Nemex. Here it's combined in a product called Verbantil, but I realize it's probably all backwards. You can't see it, but there's pyrantel in there. It is kind of the opposite of the macrolides. This is going to it's going to overstimulate the parasite. In particular, it's going to stimulate these acetylcholine receptors on muscle cells. So it causes these spastic contractions, and then that causes paralysis in a different way, and then the little worm dies. Pyrantel is really great at killing roundworms and hookworms. It's not great at killing whipworms or tapeworms, and it has no effect on heartworms, but really wonderful standard puppy dewormer. Remember, we said how puppies and kittens can often be born with roundworms and hookworms. And I wrote explain what dewormer means just because there's that stupid word anthelmetic, right? That just means it's a general dewormer. Often you'll see pyrantel combined with other things, like there it is combined with HeartGuard. You may see it combined with some tapeworm medications later, Drontal and Drontal Plus. Pyrantel actually tastes good, unlike these horse dewormers, which are really nasty tasting. This tastes good, and you might want to warn owners that that because it causes paralysis, that the dog may actually shed these worms in their poop. You might want to warn owners that, or be prepared that the next day owners may see live worms crawling around their puppy or kitten's poop. And then the last two that we'll look at here in part one are a little hard to pronounce. This one, imodipside. This one is the reason it's not super important to know that it causes flaccid paralysis, but this is a product I've seen on the shelf. It's a topical dewormer for cats, which is nice for some cats because trying to give a cat a pill can be hard. So sometimes we might send this home. It also contains this this tapeworm drug that you'll learn about. So that's probably the main thing with Profender. But you should also know that pregnant women should not handle it. So it would be important to ask clients or just tell clients that anyone who's pregnant should not handle it. You probably shouldn't even sell it if there's a pregnant person in the household. Not a real common drug, but helpful because it's unusual in that it kills nematodes and tapeworms with that prosaquantel. This last one I think is important because this is a really common product that owners will buy at the pet store. It's called piperazine, and you'll see it says for the removal of large roundworms, ascarids. What does it not say? It does not mention hookworms, and hookworms are zoonotic and they're dangerous to the puppy. So I do not like piperazine. This has a very narrow spectrum. It's okay at killing roundworms, but it does nothing for hookworms. And again, it causes paralysis. So it's junk, in my opinion. All right, so that's it for part one. Just to review, we learned that parasites are a major source of disease in all animals, including you and me, and that you play a huge role in the prevention, diagnosis, and treatment of these diseases. The major groups are the nematodes, the cestodes, the trematodes, protozoa, and these horrible little arthropods. Parasites mature through different developmental stages. And what might kill the baby will not kill the adult. That's important. One group that we talked about are the nematodes, one of the most numerous and diverse, and fortunately, mostly harmless, but some of the harmful ones are roundworms, whipworms, hookworms, and heartworms. They all have a similar life cycle, starting with these immature baby worms, the first stage larvae, that develop into juvenile larvae called third stage, and then they finally reach sexual maturity in adulthood. There's many there are many anti-nematodals. Some are more effective against certain nematodes than others. We learned about how milbemycin is really effective against whipworms, but pyrantel is not, and piperazine sucks. And understanding the strengths and the weaknesses of these drugs will help you help the clients and help their animals and help your clinic. All right, that's it for part one. I'll see you in part two.